Good afternoon and good morning to those on the West Coast. Welcome to today's webcast, an overview of the CAHPS Analysis Program 5.0, presented by the AHRQ CAHPS User Network. All right, before we begin, just a few standard housekeeping details. If you're having difficulty hearing the audio from your computer speakers, you can change the audio selection so that the WebEx can call you back and connect through your phone instead. In the event that your computer freezes during the presentation, you can try logging out and logging back into the webcast to refresh the page. Remember, though, that you may just be experiencing a lag in the advancement of the slides due to your internet connections. If you need help at any time during the webcast, use the Q&A icon that we will show you in the next slide. At any point throughout today's presentation, if you have any technical difficulties or have a question for our speaker, you may ask a question through the Q&A feature. Depending on the browser you are using, your WebEx screen may look slightly different than this slide. Look for the Q&A icon at the bottom right hand of your screen and be sure that the drop-down option displays all panelists for you to ask the question so our team can see it. Feel free to share your name and/or organization and role when you type in your question. Today's session is being recorded. The replay of today's webcast and the slides will be made available on the AHRQ website. Now, I'd like to welcome and introduce you to today's speaker. Naomi Yunt is a WestAT Senior Study Director and Industrial Organizational Psychologist with more than 15 years of experience in organizational research and analysis. She serves as the lead analyst for the AHRQ-funded User Network for CAHPS and Surveys on Patient Safety project. My name is Josh Noda, and I will serve as the moderator for today's presentation. Today, we will provide an overview of the CAHPS analysis program, provide background on key analysis guidance documents, and then answer your questions. And now, I'll turn it over to Naomi Yunt to get us started by providing an overview of the CAHPS analysis program.
Thanks, Josh. So the CAHPS analysis program is free code written for use with SAS software. To conduct the analysis, it requires not only the base SAS package, but also the SAS stat modules. You may have heard it referred to as the CAHPS macro. It's called the CAHPS macro because the group of SAS code in the program is called a macro by SAS, and this group of code allows users to repeat analyses multiple times, for example, for each item in the survey. The program enables users to analyze their own data from any CAHPS survey, for example, health plan, clinician and group, hospital, and this includes both the adult and child versions of the surveys. It can handle all the different types of CAHPS survey items, from dichotomous items or yes-no questions to the rating items on a 0 to 10 scale. The CAHPS analysis program, or macro, calculates all the basic results users of the CAHPS surveys may want. This can include top box scores, which are the percent of respondents answering the most positive response option, such as always, mean scores, full frequencies for all the different response options, for example, the percent answering always, usually, sometimes, and never, as well as collapse frequencies, for example, the percentages for those answering always, usually, and then collapsing those answering sometimes and never. The macro can do this for individual survey items, as well as composite measures assessed by the different CAHPS surveys. Composite measures combine 2 or more CAHPS survey items that measure the same dimensions of patients' experiences with healthcare services. But it does more than that. So, it also provides case mix adjusted scores. And it also provides, so the case mix adjusted scores adjust for things that may impact CAHPS scores due to things outside of their control. For example, respondent age or other socio-demographic characteristics that could affect the entity's scores. Without such adjustments, score differences between entities could be due to differences in external factors rather than true differences in performance on the CAHPS measures. The macro also indicates whether an entity score is statistically different from all the other entities being analyzed. It can also weight the data to weight up to the population. For example, if you're looking at health plan data, it can weight up to all the eligible enrollees. Weighting can also be done at the item level when calculating composite measures. Since composite measures are comprised of multiple items, you may want to equally weight the items. For example, a straight average of the item scores. Or maybe some items have low response, so you want to more heavily weight items with higher response than those with lower response when calculating the composite measure score. The macro can do this for you as well very easily. It can do some other complex analyses, so this is just a highlight. For example, post-stratification weighting and imputation. So before you think about using the CAHPS macro, you should think about what level do you want to report the results. Any analysis of CAHPS data is intended to assess, compare, and report on some type of reporting unit. Those units could be regions, states, sponsors, plans, clinics, or individual physicians. Because the CAHPS analysis program was initially written for the CAHPS health plan survey, the reporting unit variable used in your data set, so that variable name, and that will be used by the analysis program, is plan. So in other words, the variable plan must be on your data set. So this is an important caveat. However, even though the variable plan must be on it, this name has no bearing on the suitability of the program for analyzing data on the other types of entities. So if you wanted to say, use your data to look at both plan level results as well as sponsor level results, the macro can do that for you. You would just have to rename your plan variable to sponsor to do it at the sponsor level. So it's just one minor caveat there. The next thing you want to think about, or do you want to case mix adjust your results? This can be particularly important if you want to compare entities to a group score. And then you and your team will want to think about if you want to weight your results. You can decide, do you want to weight up to your population, your target population? And you also want to think about if you want to weight items within the composite measure based on the number of respondents. And again, as I mentioned, there are other weighting options available. So once you've thought about, the question is, do you need to use the macro? Should you use the macro? Will it benefit you? The macro provides the most benefit to CAHPS users who want to make comparisons of entities to the average of all entities. And again, by entities, I could be talking about health plans or practice sites or hospitals. I'm just using that as a general term across all. The macro allows you to do this, and it does it in a standardized method for making these comparisons, and it allows you to do case mix adjustment in a standardized way. Now, if you just want to examine unadjusted, unweighted top box scores or mean scores for a few entities, you don't necessarily need to use the macro. Almost any statistical software package can do that for you, including Excel. When you cannot use the macro is if you're only doing this for one entity. So if you're just looking at your entity score, or, and hopefully this would never happen, if you have less than 2 responses within an entity, you cannot use the macro. And of course, we hope you have more response than that. And the macro actually will flag any entities with fewer than 100 responses. So what's new? This is documented in one of the documents I'll be talking about later, but in a nutshell, there are several updates that have been made. First, corrections and updates for weighting options were made for case mix and the overall mean. In addition, this version adds a proc survey reg option. This is something specific to staff, and it is designed to handle complex survey sample design and adds a clustering option for case mix adjustment. In addition, the output when using case mix now includes a standard error along with coefficients, case mix coefficients and p-values. And finally, within the CAHPS macro zip file, there are test data sets, and the test data sets were there as to run sample code, and we have updated them. They were based on a very old version of Health Plan, so we updated them for clinician and group, and then we modified the test programs to go with those data sets. We streamlined them and numbered them, so it's very clear which ones to run first and how it aligns with the data. So when you go and you download the analysis program zip file, you'll actually see 7 files. So that can seem a little overwhelming. The core file is macro_CAHPS50, and this is the SAS macro program. So this is something that should not be modified. This is what you call in all your SAS code, and it does all of that analysis for you behind the scenes. In the zip file, there are also 4 program files and 2 SAS data files. Let me run through these very quickly. We've numbered them so that you know which order to run them in. The first program file creates formats for the test data. Basically, this is helpful in viewing the data so that instead of having L1, 2, 3, 4 as response options, it labels them. So, for example, 4 would be always. And then the second step is just sample code on how to recode your variables that are needed to run the macro. For example, for yes, no questions that might be standardly coded as 1, 2, it recodes it to 1, 0 to be run through the macro. Then 3A, test_CAHPS50, provides your real examples of calling the macro, your SAS code. And we'll talk about that in just a minute. And then 3B provides a more complex example using post-stratification weighting for those who might want to do that. And then the test data files, we have the test_CAHPS50 data, and this is the raw test data. This is before any recoding. And we've also included the recoded data. So, for example, if you don't want to always run the prep data program file to recode your variables, you can just go in, use the recoded data, and run some of the practice code to see how it's working and what's going on, or modify the code for your own data set. So for those of you who are familiar with SAS programming, I thought I would take 1 minute to show you how simple the code can be to get results. This is a sample code. This is actually the base of what you'd need to do to run it. There are only 6 required parameters. I put them on separate lines, so it's very easy to see. So let's run through these one at a time and see what this is really doing. The macro needs to know at least 6 things. First of all, it needs to know what variable it's going to be analyzing in your data set. So the first thing you tell them is bar equals. And here I'm telling it, I want you to analyze question 5. The second thing you need to tell the macro is what type of variable is it? Is it on a dichotomous scale, 1, 0? Is it a 3-point scale? Is it a rating scale? And so you need to let it know which type of scale it's using. Then you have the name, and that's just something you want to label for the outcome variable. So it's just what you're labeling it. Now, what I haven't talked about is adult kid. Adult kid is needed also because the macro can analyze both adult and child data separately or together. And so this lets it know, are you doing adult data? Are you doing kid data? Are you doing both? And here, this example, I'm saying 3, which means analyze adult data only. It then needs to know where your data are. So data set equals, and then you tell it what the name of the file is. And then finally, outname. When it goes output files, you can tell it, this is what I want you to call the output file. And here I'm just saying appointment. So from this simple code, I will get my top box scores, my mean scores, the percentages for all the response options, the overall results for all the entities combined, as well as my results for every entity in my data set, and significant differences. So just from these 6 lines here. So that was a pretty simple example. I wanted to take a second to show you a little more complex, but really we're only adding 1 line. So here we're analyzing a composite measure and we're doing case mix adjustments. it knows it's a composite measure because in my var statement telling them what variables to analyze, I'm including two variables. Slot lets it know to combine those two to create the composite. Here, just to show you a little difference, var type, the type of variable, I'm saying is 3, it's a 4-point scale. I've named it again, sample composite measure. Adult kid, here I'm showing 0, it's analyzing all data. And then the new line is adjuster. This tells me I'm going to be case mix adjust the output. And for this example, I have just two case mix adjustment variables, mental health status and general health status. Then again, we have the data set name and the output name. So with this macro run, I get the same exact results as I got for the previous run, but now I'm getting it obviously for composite scores, and I'm getting adjusted and unadjusted scores, and my significant differences are based on the case mix adjusted scores. All right, so that was a lot, I am sure, and I ran through that relatively quickly. So there are some guidance documents available to walk you through this that can be hopefully really helpful. The two that I'm going to talk about today are preparing data from CAHPS surveys for analysis, and this document can be used whether you're using SAS or not. And then the second one is if you're using the CAHPS analysis program in SAS and its instructions for analyzing data using that. So these documents and the CAHPS analysis program can be found on the CAHPS website, which is at www.arcs.gov/CAHPS/surveys-guidance/helpful-resources/analysis. So let's talk about each one of these. So the preparing data for analysis document explains how to take returned CAHPS surveys and enter and clean the data so that it can be analyzed using either the CAHPS analysis program or some other statistical software. This includes identifying and including ineligible cases, cleaning the data, identifying complete and partially completed surveys, and recoding variables for analysis. Then it also provides an overview of how to calculate top box scores and collapsed frequencies and mean scores that are helpful whether or not you're using SAS or not for any kind of software. The instructions document provides a lot more detail of what I've talked about today. It provides detailed instructions on how to use the CAHPS analysis program. It provides more sample code, and it has an appendix with detailed statistical explanations. It also has an appendix of all the different additions that have been made to the appendix between versions. There are a couple things I did want to point out that are new to this version, and that are there's two tables. Table 1, which is 6.1, that I'm going to talk about, it has the required parameters. So it lists those 6 parameters I just went through that are required and what options you have for each one of them. So the var type, what is 1 equal? What is 2 equal? What is 3 equal? It tells you that. It spells it out so you know exactly what you need to specify and for the most basic run. And then table 6.2 provides all the optional macro parameters for weighting and for case mix. And it's grouped by what they do. So if you decide with your project team, we're going to do weighting and we're going to case mix adjust, you can go right to that table and say, okay, well, what are the things we have to consider in weighting? Because here are my options. So it can really help you do a step-by-step figuring out how you're going to write the code and how you're going to analyze it. Then also added was a list of the output files. I just want to give a heads up for those who haven't used it. When you're running that simple code with those 6 required statements, you don't get one SAS data set with all of your responses. You actually get 6 SAS data sets. And that's because some of them will give you the flags of the entities that have less than 100. It'll give you your scores overall, like the average across all entities in it. And then it'll give you your scores for each entity. So they break it up into different output files. And what this section of the document does is it lists all the output files based on which options you select. And then on top of listing it, it will tell you the contents and how to interpret the contents within those data sets. So this document can really take you from how to write the code, what parameters you want to use, to understanding the output from the files that are created. Now, I did want to take a moment to acknowledge Alan Zaslowski and Kaya Walsh, both from Harvard Medical School, who are not only co-authors of this document, but are really the masterminds behind the macro itself, doing all these updates and tests and modifications. So I hope they're both on today, and I just want to say a shout out to them for a great job. So at this point, I'm going to turn it back to Josh for the question and answers.
All right. Thanks, Naomi. Appreciate it. Very informative. So as a reminder, you can type a question in the Q&A box. To ask a question, look for the Q&A icon at the bottom right-hand side of your screen, and be sure that the drop-down option displays all panelists so our team can see it. Feel free to share your name and/or organization role when you're typing your question. Again, depending on the browser you're using, your WebEx screen may look slightly different from this slide. And as you can imagine, Naomi, from such an informative presentation, there are several questions that we have received. So I'm going to go ahead and read them to you and let you respond. So the first question we have is, can the CAHPS analysis program be used for analysis of supplemental items?
Great question. Yes, it is very flexible. It can be used for analysis of all the different types of survey questions, including the supplemental items.
Okay, great. The next question I have here is, when reviewing the updated documentation, one user noticed that the formula for calculating reliability is no longer included. Was this deliberate? Is the formula no longer endorsed?
Good eyes. So that was in the statistical section, the detailed statistical section. And actually that section we did remove, but the equation can still be used. We wanted to recognize that there are other ways to calculate reliability, and we may include a larger, more comprehensive section on reliability in the future. It sounds like that might be of interest to some. So that's good to know. Thank you.
All right. Another question I have here is, do you have a step-by-step guide on how to set up the HCBS CAHPS macro after preparing the data?
So it's not specific to HCBS, no, but you could use the instructions document and apply it to that survey. And I will add that if there are technical questions or you have questions about specific using the macro, you are welcome to email us at any time. I'm sure, Josh, you'll share that email address at the end, and we are happy to answer it. And if we can't, we can always reach out to the macro creators, both Kaio and Alan, to ask for help.
Yeah, good point. I will be sharing at the conclusion of the Q&A section where people can find additional resources to reach out to us for that technical assistance. Another question I have here is somebody would like you, if possible, to talk about the specific corrections and updates for weighting options or case mix adjustment and the overall mean.
Thank you. So I will point you to the instructions document in the appendix that will provide a little bit more detail, but I can say a couple of things. There was a correction made to the weighted variance estimation. This update corrected an error in the previous version that failed to take into account differential weighting at the individual level. And so the mean scores were not affected by that update, but there's other options that were also added that it's like half a page or so long, and I'd point you there probably. That would be the easiest way. And if you have follow-up questions, please do reach out.
All right, thank you. They're coming in fast now. Another one I see here is, can you discuss more about the imputation? The macro imputes missing values for case mix adjusters, but not for CAHPS surveys items. Is that correct?
That's correct.
Okay. And then one person wrote, they said they appreciate your reply on the reliability, and they were wondering, will this ever become part of the macro?
Well, that's an interesting idea, and we'll pass that along.
Okay.
Thanks for the
Great.
feedback.
Another question I have here is about, are there things besides the calculation of reliability that are no longer included in the package? Or are there major changes to the other things that are calculated that users should be aware of?
No, I think actually the reliability section was the main section in the statistical details that we removed as we had wanted to do a more major update. And as far as other changes, again, in the appendix, you can see the minor and more substantial changes that were made to the macro between versions. And if anything is unclear, I'd ask you to just reach out to us and we can follow up with you on that.
Okay. And is there a section of the documentation that outlines all the changes to this year's macro?
Yes. In the appendix of the instructions document, I think it's the last appendix, it lists every single change, and not just from version 4 to 5, but all the versions. So you can see the iteration across the years of all the different edits. So for example, if the last time you used the macro was version 2, you can see the differences between now and then. It's cumulative.
Okay, thank you for that. I think we have time for about 2 more questions. So one is, can this macro help produce tables and export to different worksheets in Excel?
Yes. So it will produce output, and it can produce SAS data files. It also produces output if you want it to within SAS itself. You can use those SAS data files to export into Excel, if that helps.
Okay, and then one final question, I guess, related to SAS. Is SAS the only program the CAHPS analysis program can work with?
Yes, at this time, the CAHPS analysis program is made for use with SAS. There is some preliminary work being done to create another program for R if there's interest, and if there is, you can reach out and let us know, but that's sort of in the works.
All right, thanks. I'm going to let you off the hook now. Very informative presentation, and thanks for answering those questions.
Sure, thanks for the good questions.
All right, so we periodically send email announcements out about CAHPS news, such as new webcasts, data submission timelines, and other products. We just wanted to highlight you can sign up for these email updates from us by going to the AHRQ website, clicking in the right-hand corner, and choosing the email updates associated with CAHPS Consumer Assessment of Healthcare Providers and Systems. You may contact us at the CAHPS User Network at any time via email at caps@westat.com or via phone through our toll-free line at 1-800-492-9261. And you can also access the CAHPS website at www.ahrq.gov/CAHPS. A brief webcast evaluation will pop up when you close out today's webcast. Please take a moment to provide us with your feedback, as it helps us improve our offerings and plan future events that meet your needs. We invite you to visit the AHRQ website and contact us at any time by email or phone. Thanks again for joining us, and this concludes today's presentation.